on to the next talk, which is again a pre-recorded talk. Dr. Haotian LIN on AI monitoring for retinal diseases. Yes.
Friends and fellows, good afternoon. I'm Haotian LIN from Zhongshan Ophthalmic Center. Thanks very much to the organizers for this invitation. Today, I'd like to share with you our team's experience in retinal AI. Before the sharing, I'd like to introduce our hospital briefly. JOC is the leading eye hospital in China, serving over 1.4 million outpatient visits annually. We now serve as the WHO's collaborating center for eye care and vision, and host the headquarters of APAO. On the occasion of our 16th anniversary, we are excited to host the International Ophthalmology Hospitals Presidents Summit. We welcome you to reunite in Guangzhou for this prestigious ophthalmic assembly and immerse yourself in the charm of South China. As we know, due to the factors such as population aging, changes in modern lifestyles, and increasing premature birth rates, retinal disease are on the rise. However, ophthalmologists are scarce globally, and the gap between the growing demand for eye health and the limited medical resources is widening. How can we bridge this gap? AI technology, which has emerged in recent years, is an attractive solution. AI won two Nobel Prize in 2024 and has potential to promote the entire medical process. Many AI technology have been developed in recent years for assisting in the diagnosis and treatment of retinal disease. Despite the potential, some studies have reported that the real-world application of AI technology is not satisfactory. AI models' performance significantly decreased in real-world diabetic retinopathy screening scenario, with over 20% of images unable to be recognized and inefficiency. How to apply intelligent technology still faces many challenges. From the perspective of clinicians, we found there are two main challenges. First, poor quality images in the real world lead to significant decline in AI performance. Additionally, there is a lack of effective application pattern. To address these challenges, we have conducted a series of studies. First, the diagnosis of retinal disease is highly dependent on image features, and the quality issues are a common problem encountered by all image-based models when applied clinically. Therefore, we developed a fundus color photography image flow cytometric system that assesses the quality of fundus image from 3 dimensions in integrity, illumination, and clarity. This system enables comprehensive and intelligent assessment of fundus image quality. Further, in view of prominent quality issues in infant fundus photography, we developed a deep quality system which can target enhanced image quality. This system makes retinal reeds, arches, vessels, and other lesser features more visible. We also demonstrated that improving image quality can significantly improve the diagnostic accuracy of retinopathy for both doctors and models. After solving the most critical image quality problem, we conducted real-world studies on intelligent technology. To achieve better performance of AI models in clinical practice, we collected representative fundus photography from tertiary hospital, community hospital, and physical examination centers, and developed the intelligent system CARE with over 200,000 images. It can recognize 14 types of fundus diseases. We deliver care in 35 different medical institutes in China for prospective validation, covering 82% of China's provinces. The results show that the model performed well in different scenarios, with an average AUC greater than 0.95. Part of the diabetic retinopathy technology has also been approved as the first Class 3 medical devices in ophthalmic AI in China. This real-world validation pattern has been recognized by peers. The relevant results have been published in Lancet Digital Health and received many positive reviews. In addition to different levels of medical institutions, we also applied intelligent technology to the screen of fundus disease in the elderly population in rural areas. Compared to urban population, rural population characterized by poor economic conditions, limited medical knowledge, and lack of health awareness needs screening even more. We combined the previous development model with a cloud AI platform to provide seamless service for rural population. In this study, we screened out 1,895 patients with fundus disease, accounting for 60.2% of the total number of people screened. This proves that AI application in rural screening scenarios is feasible and necessary. This is also the first prospective study on AI screening for retinal disease in rural areas in China, and the relevant results have been published in the JAMA Ophthalmology. For more remote areas with even more scarce medical resources, we developed an intelligent ophthalmic mobile vehicle that integrates our developed AI technology with commonly used ophthalmic devices. This provides door-to-door eye disease screening and diagnosis service for residents in these areas. The mobile vehicle has traveled over 180,000 kilometers in China, covering 28 provinces, 108 cities, and serving over 150,000 people. Finally, let's make a summary. We focus on the core issue of how to effectively apply AI in clinical practice. We first address the image quality issues associated with AI application. Then, through our efforts, we explored reasonable application patterns. The application of AI technology for retinal disease starts from medical institutes, such as tertiary hospital and community hospital, gradually extend to the screen of population in rural areas, and finally providing door-to-door eye disease screening service for residents at remote areas with scarce health care resources. This achieved expansion and sinking of high-quality medical resources. And last, I'd like to thank all the members of Retinal Group in our team for their efforts in the research. This presentation is organized by Li Longhui. Also, thanks to all the kind peers for their help and guidance.